Joining us right now, we've got former Secretary of State Hillary Clinton, current presidential candidate. Secretary Clinton, thanks for taking the time to speak with us today. Welcome to the program.
Well, thank you so much for giving me this opportunity. I very much appreciate it, Jason.
No, we appreciate you taking the time to talk to us. And before we discuss the Flint water crisis, which is what I know you want to talk about, we're just a few days out from the Iowa caucuses. Is that where you're calling us from? How's it going out there?
That is where I'm calling you from. I'm calling you from Des Moines, and it's going great. We are, crisscrossing the state and these last few days, talking to hundreds and hundreds of people in small towns and large, and, working to make the final argument that I am trying to get progress, real progress for people, and not, have a gridlock or a backward move that will rip away our efforts to try to, do what we need to do in this country. And I've been very specific about my plans, and I'm getting a good response. So we'll see what happens Monday. It's always a race to the finish line.
Sure. A lot of commenters out there and analysts saying supporters are worried about a possible repeat of 2008. And as I was talking about earlier in the program, it's a tight race between you and Senator Bernie Sanders. If you could just give your comments on that.
Sure. Well, of course, this is 2016, not 2008. And while Senator Sanders and I have a lot of the same goals, we have some serious disagreements on policy. Take health care, for example. I've been working for decades to make sure every American has quality, affordable health care, and I think it's vital we build on the progress we've made with the Affordable Care Act. Nearly 90% of Americans are insured today because of it. Senator Sanders wants to start the health care debate all over again, creating a whole new $15 trillion program that I think would gridlock the country. And you compare that with the Republicans who have tried to repeal or dismantle Obamacare 62 times. I think we've got to defend it, improve it, not throw the country back into another contentious debate. So that's just one example of a fundamental difference in how we approach things. And I just have met so many people who can't wait. They're struggling with the high cost of prescription drugs and premiums, and I don't think we can wait years for another health care debate. I want to get to work right away and really start helping people out.
Well, you brought up the Republicans. Your name was brought up quite a bit in last night's Republican presidential debate. Your thoughts on that, and were you surprised Donald Trump wasn't there?
Well, I was out campaigning, so I certainly didn't see it, but I've heard about it, and yes, my name was mentioned quite frequently. But, what was also mentioned was repealing the Affordable Care Act and defunding Planned Parenthood and denying a path to citizenship for hardworking immigrants. So I don't take any of what they say personally. I take it as a serious threat to the lives and futures of so many Americans, and that's what I'm going to be fighting against.
Well, I appreciate you answering those questions about the campaign. Let's talk a little bit about Flint, which is the main reason we're talking today. You used your closing remarks in the last Democratic debate saying you were angered about what was happening here. For those that might have missed that or didn't hear, remind our listeners a little bit about what you said.
Well, I think it's just absolutely unconscionable that residents of an American city have been living with water so dangerous that GM won't even use it because it was corroding their car parts. And I just can't get this out of my mind. I mean, if the water in Flint corrodes engine parts, imagine what it's doing to the children of Flint. It's just heartbreaking, and I really think it demanded the kind of national attention that I tried to give it, because it's a perfect example of failing to do what we should to make sure every single person in our country has the chance to have a decent standard of living. And what's more basic than water? Now, I have been following developments closely. I welcome the news that the governor and legislature are finally seeing the need for comprehensive health care access for kids in Flint who may have been exposed to dangerous amounts of lead, and I support the measure introduced by your senators, Senator Stabenow and Peters, and your Congressman Kildee, to help Flint's families. And, of course, I support President Obama's commitment of $80 million to help improve Flint's infrastructure. But the fact remains, they should not have been exposed to lead in the first place in Flint. And as I said in the debate, if it was happening in a wealthy suburb of Detroit, the problem would have been fixed months ago. So if I become president, look, this is what I care about. This is what I've worked on. I've spent years trying to even the odds for people who have them stacked against them. And, you know, tragically, Jason, we know there are more Flints out there. Many places where low-income communities and communities of color are struggling to deal with lead paint, toxic soil, unsafe water and air. And I am just not going to accept the status quo. We have to grapple with economic justice, racial justice, environmental justice altogether. And this is a very sad but telling example.
I want to follow up on that remark there about wouldn't happen in a rich white suburb of Detroit and talk about race relations a little bit in this country. President Obama ran on building better race relations in this country. Do you feel we're better off than we were a decade ago or more divided? And do you honestly feel that a Republican would deliberately poison children and adults to save money? As we know, Flint was in a financial emergency at the time some of the decisions went into effect.
Well, I think we've got to get to the bottom of who knew what when and what decisions they made. The highest priority now should be doing everything that can be done to help the children and families of Flint who've been drinking and bathing in poisonous lead-contaminated water while their cries for, help were ignored. And that's just a fact. People were showing up with the smelly brown water. Kids were having rashes. And, that's why we need comprehensive health monitoring of anybody exposed to lead. And I think the state should set up a future fund to take care of children who've been poisoned. As I understand your budget in Michigan, the governor is sitting on a budget surplus and a rainy day fund. And if there were ever a rainy day in Flint, it's right now.
We've only got you a couple more minutes. After you brought it up in the debate, Governor Snyder's responded, certain people are politicizing it. Now's not the time to do so and work on the solution. Thoughts on those comments? And also, do you see any blame at the federal level in this? An EPA employee was trying to bring this to the attention of his superiors for months, and then the Region 5 Midwest chief just resigned over this. Your thoughts on that?
Well, I don't call what I and others did politicizing it. I'd call it getting results. And I think we should be grateful that the country is coming together behind the people of Flint. I really hope that it's not just for the short term, but that it continues to bear results and get things done for people who really need help right now. And wherever there may be anyone in a position of responsibility who knew or should have known about what was happening in Flint, we should follow that trail. And I'm aware that one of the federal officials did resign. I think that is wholly appropriate. Because when you are dismissive of people's legitimate complaints, that should raise red flags. I sent two of my top campaign aides to Flint because I wanted to hear from myself, from Mayor Weaver and others, about what we could do to help. And it was just heartbreaking to hear the stories about kids getting rashes, losing their hair after bathing in the water, and that local and state officials were dragging their feet requesting federal assistance. So I listened to what the mayor said she needed, and then I called for four things. I said FEMA needed to determine where the water infrastructure had been damaged and would need to be replaced. I said the governor should ask for federal assistance. The federal government should step up and be a partner in making those repairs. And above all, that the governor needed to call on the federal government to help set up a comprehensive testing and health monitoring program for kids who have been exposed to dangerous levels of lead, because lead poisoning, and I know this from the work I've done from my years with the Children's Defense Fund, the work I've done as a senator from New York, where we have a lot of old housing with, peeling lead paint, lead that, gets
20
into
more
the,
seconds, Secretary Clinton.
the cracks on the floor. So, we've got to face this. Lead poisoning can cause lifelong complications, learning and behavioral problems, even lasting brain damage. So, let's all get together and make sure we take care of the long-term damage, the health and education needs of the kids who were exposed.
Well, we appreciate
to these
your
high
time
lead
today,
levels.
Secretary Clinton.
Thank you.